All right, welcome everybody who's here with us on Zoom. Also, welcome to all of our friends on Facebook who are also joining us. We're super excited to have this conversation this evening with some wonderful panelists. So if you're joining us on Facebook, share it with a couple homies, share it with a couple friends. If you're here with the Zoom, invite somebody else in this moment. We're gonna play one more song to give folks a chance to settle in, maybe grab a cup of water and get going, and we'll get started promptly at 6:05. So I'm gonna play another song. I don't know what I have queued, but we're gonna get started at 6:05.
Some babies running out of time for waiting. Freedom and triumph, they weren't meant for me. Girls of my color find something else to be. I'm better, I'm better, I'm better, I'm better, I'm better, I'm better. I'm better, I'm better, I'm better, I'm better, I'm better, I'm better. I'm better, I'm better. Something only bodies here. Promiscuous holiness, slope is slippery. I got all this time to kill. Something like a prayer to kneel to. Lay on my pillow, you think I'm so weak. Soft as my skin is, my power's discreet. I'm better, I'm better, I'm better, I'm better.
All right. Thank you so much, everybody, for joining us tonight. Shout out to all the Jamila Woods fans in the crowd tonight. I love Jamila Woods. My name is Devin. I am the Coalition and Membership Manager here at the Roundtable. And one of the things we thought was super important is to have a public conversation about public money. Right, we wanted to invite a couple really wonderful people to talk about the American Rescue Act plan, some of the work they've done last year, but also to talk about and name particularly where we plan to go this year. So if you're joining us on the Facebook, share this, invite a friend, because these dollars are our dollars, and this conversation needs to be shared in all the places to make sure we get this information out. Before we start this evening, I want to name very particularly that has been a tough couple of days. A lot of things have happened, including the fact that we've seen yet again that Black people in this country aren't safe. We're not safe in the park, but we're also not safe going to the grocery store, as we saw in Buffalo. And want to just name and just like share a little bit Audre Lorde. Sort of in moments like these, I go to the books, I go to reading. And Audre Lorde, in part, in her wonderful poem, A Litany for Survival, writes, "For those of us who are imprinted with fear, like a faint line at the center of our foreheads, learning to be afraid with our mother's milk, for by this weapon, this illusion of some safety to be found, the heavy-footed hoped to silence us. For all of us, as hesitant and triumphant, we were never meant to survive. And when the sun rises, we are afraid. It might not remain. When the sun sets, we are afraid. It might not rise in the morning. When our stomachs are full, we are afraid. When our stomachs are empty, we are afraid. When we are loved, we are afraid. Love will vanish. When we are alone, we are afraid. Love will never return." And this is like the moment that I'm excited to share. And when we speak, we are afraid. Our words will not be heard nor welcome. But Audre Lorde writes, "But when we are silent, we are still afraid. So it is better to speak, remembering we're never meant to survive." I wanted to share that, to welcome in that space. That, like, right, to welcome in that space, it's okay at moments to be afraid, to double check. But we also have to remember to join the fight, to be deeply engaged in this process. So I wanted to welcome that. I also wanted to know we're also in a moment, a different moment, as my colleague Jordan reminded us yesterday. We're in a different moment locally. And I hope I can find it quickly. We're in a different moment locally where we saw, in many ways, a mass shooting this past weekend outside the Bucks game. And one of the things I wanted to name in this moment is that the response we're seeing by elected officials is not the answer. And I'm reminded of what Miriam Kaba said, because it was on a call earlier today, and just in conversations, a lot of people are feeling this. Miriam Kaba writes, in part, and I'm thinking about this as elected officials, instead of answering to root causes, they go to criminalization. And Miriam Kaba writes, "I dread the summer. It's the season of hyper surveillance and even more aggressive policing of our young people of color in my neighborhood." She goes on to write, "Public spaces in urban and suburban towns are contested. Residents collude with law enforcement to police and enforce boundaries. Young people of color are criminalized not only by the police, but also by the community members. I read that to say and to name, we are not here at the roundtable want to minimize any of the violence or any of the harm that people are living and experience. What we want to lift up is what Robin Kelly calls freedom dream. Alternate versions of what is possible. We know these moments do not just come out of thin air, but rather they've come from systematic disinvestment, systematic disengagement from young people. And we reject the contesting of public spaces. Instead, we want to come together and figure out what are the things we need. That's in part why we're having this conversation. And then the last thing I'll share, and then we'll get going. I do want to lay ground tonight because it's important that we lay ground. In this wonderful book, In Our Times, Barbara Ramsey lays out what our freedom dreams look like. And I want to invite us to think and imagine what our freedom dreams. She writes to our ancestors. So she's writing from the future, looking back at the past. In part, she writes, with all that we've improved, we don't want to give a false impression that we live in some kind of la-la land. There are still struggles to be waged. Human beings still hurt each other and succumb to their less beautiful selves. She also writes, but we don't have wannabe tough guys running around in uniform, waving guns and shooting people. As sites of conflict resolution, we have built freedom squares in every city and every town. Problems do arise, we go to the freedom squares. People can be safe there. They can get comfort and support. Trouble-busting teams are ready to strategize and to de-escalate, to resolve a grievance. Decisions are collectively made, but according to a set of principles, values, and priorities we have set together. She concludes with writing, day by day, we are making the impossible possible. And then we're daring to dream even bigger. Another invitation to engage deeper in these moments are not the times where we run to our house and stay there, but these are the moments that we have to reclaim the public square. We have to reclaim the public square. Sounds good. We have to reclaim the public square and we have to dream bigger time and time again. With that, excited to get into this conversation tonight. And maybe let's pass it to Reverend Brisco. I introduced myself. Let's pass it just to Reverend Brisco for a brief introduction of who you are and who you're representing tonight.
Thank you, Devin. My name is Reverend Willie Brisco. I am Associate Minister at New Covenant Baptist Church, where my pastor is Pastor F.L. Crother, and we're located on 38th and North Avenue. I come to you by way of MICAH and Wisdom, and nationally the Gamaliel Foundation. I entered this network as a part of MICAH Jobs and Economic Issues, where out of that issue was formed the the Ezekiel Project, which is called Ezekiel Hope, which stands for Homeownership, Partnership, and Employment. I entered this in a need to see that our young men and young women in this city had a place to work, to live, and to prosper. That is what we represent in Ezekiel, and that is what I represent in MICAH, because we believe in health, wealth, economics, and also the prosperity of our people.
Thank you, Reverend Brisco, for that. Let's pass it to Ricky.
Yeah, thanks, Devin. And thank you, Reverend Brisco, for that. My name is Ricky Diaz. I am the chair of the Coalition on Lead Emergency. We've came a long way in this past 4 years. We are a grassroots volunteer-led effort with individuals from many different organizations. Pastor Dennis Jacobson of MICAH is one of the founding members and plays a big role. So much of what Reverend Brisco was saying, I can identify with. I will also say that we have a unique structure in that we're made up of 4 different committees for right now, at least. And those 4 different committees are education, so getting the word out to folks about how serious this is and what are steps you can take to protect yourself. Educating service providers, community groups, schools, and folks who service the populations who are most vulnerable to lead exposure. We also have our Workforce Development Committee, which seeks to get good paying jobs in the lead abatement field, especially in those zip codes that are highest in lead poisoning, which share the demographic of also having low median income level. Many of the places that are hit hardest with lead poisoning have a median income level of less than 20,000. So we need to make sure that we're getting folks the right kind of workforce development training and jobs after that training is done that pay good dollars to help with this very serious issue of combating lead poisoning. We also have a policy advocacy committee which focuses on policy. That committee has really been influential in influencing the city budgeting process and most recent ARPA hearings. So I'm looking forward to getting into the conversation. And then last but not least, we have our Co-Parents Lead Committee, which is our committee composed of parents who have lead poisoned children. So, that's really the core of what we do and why we do it, listening to stories of, those family members are part of the COLE, and then also when we're out in the doors and in the community, listening to folks' real life experience with taking care of a lead poisoned child and the kind of help and treatment they got along the way.
Yeah, thank you so much, Ricky, for sharing that information. And for folks joining us on the Facebook and the Zoom, feel free to put your name in the chat. And maybe one question I was thinking about, and I always think about, is that you could answer as well. What would you do if you were in charge of spending $200 million? What would you do if you were in charge of spending $200 million? So feel free to put that, your name, and an answer, a response to that question in the chat. And as you do that, I'm going to begin the presentation. All right, perfect. So how this is gonna go this evening, we're with y'all till about 7:30. I'm gonna be giving a couple different presentations just to lay a little bit of ground and give a little bit of context for around the American Rescue Act. And then we're gonna move into conversation with our panelists, Ricky and Reverend Brisco. And feel free to put questions, and we'll have some question and answer towards the end, but feel free to put them as they come, and we'll hope to get there. So the American Rescue Act plan, what is it? This was the stimulus bill that President Biden signed when he took office in 2021. It was a huge stimulus bill. I think in total about $2.7 trillion. Another big part of that was on the campaign, maybe he promised us $2,000. In reality, I think we got $1,400. So you might remember that from getting the $1,400. But also in this bill, made an unprecedented investment into local and state governments. $350 billion was put into those governments. And this is how it was allegedly or is supposed to be used, the allowable uses. It was supposed to be used for public health emergency, to respond to the public health emergency, to provide government service that were reduced, to make investments into big time programs like water, sewage, broadband infrastructure, big time infrastructure programs, and also to provide premium pay for essential workers. What they said was not allowable by use was for states to use this to create tax cuts. And they also said that the states cannot use this to pay down pension liabilities. There's argument about if maybe Milwaukee might be planning to break one of these and spend on unallowable uses, but I didn't say that, but we're gonna get there later. What did that mean for Milwaukee? That meant Milwaukee was gonna receive $394 million over 2 installments, with the first installment being paid last year in 2021, around this time in May of 2021. So you can see that close to $400 million coming into the city to expand programs. In reality, this is how the first half of the first $197 million, the first tranche, as maybe some people have called it, of the money was being used. So you can see it's sort of the generic breakdowns of this. Like the biggest one, the yellow one, is services for disproportionately impacted communities. $63 million went there. 54 went for revenue replacement. So that's really not expanding services, but instead that is just like filling budgetary gaps and holes. A 23 million for public health and 20 million for negative impact. So we're gonna dig in a little bit more. So within that category of services for disproportionately impacted communities, this is how the money was spent. And you can see 26.1 million was allocated to lead. We're excited to talk to Ricky about some of that in a little while. We can also see the next biggest one was for housing, for both in-rim housing and Westlawn. And we're excited to talk to Reverend Brisco about that. Other big things within that category were stipends for early childhood education professionals. And you can sort of see the last few. Within the revenue replacement, we can also look and see what which was the second biggest pot of money, what is that has been used for or allotted for. The biggest one is for firefighters, right? Just like that was something they could take out of the general budget and just put on the ARPA bill. And so we see about $15 million going for firefighters, $10 million going for street lighting. And then we also see that, firefighters come up again. The one thing that that I think some of us on this call might eventually use is the MLK library. That was funded, it's gonna be funded through ARPA, and that'll be built and begin construction. All right. So far, so last year in October, so that is 7-8 months ago, these allocations happened. This is how much they've spent so far. Not much, not much. You can see for housing and neighborhoods, they've only spent $179,000. In total, out of the $197 million they've allocated, only $11 million have been spent. So with that, a little bit of background information, I'm gonna stop sharing for this moment and move into some conversation with Ricky and Reverend Brisco. Reverend Brisco, last year, I remember loud and clear, folks asked for, and you were a part of it, for a huge investment into housing. Can you talk about how y'all came up with naming that housing? We need to be using this one-time money to invest in housing.
Well, there's a shortage of affordable housing in the inner city of Milwaukee. There's a shortage of homeownership in the city of Milwaukee. and there is a shortage of livable houses in the city of Milwaukee. We still have a number of boarded up, dilapidated housing that the city sits on and lets deteriorate till they are no longer on the tax rolls, which increases the tax rolls of our other homeowners. We came up with, and this is specifically with us in Ezekiel, came up with a homeownership avenue, an employment avenue, and a low-income housing avenue to try to recover some of these dilapidated and run-down houses. But just as this recovery money has been given to the same people, the same bureaucracy that handles our budgets and everything yearly, this is another recipe for mismanagement. So what we're doing now is trusting the same managers of a fund that we trusted with the management of a budget that had left the city in this dire straits that we're in. And we now are trying to ask for funding, ask for resources from the same people that got us into the situation in the first place. I remember a program years ago called The Wire. And one thing came out of this program was follow the money. If you want to see results, follow the money. So right now, we're in the process of following the money, and we are seeing that the money is now being trapped in the system, slowly trickling out, and not reaching the areas that that needed the most. So what we did a year ago was try to put pressure on the entities before this money was distributed, before it was handed out, in order that we didn't have rents that are going sky high. Homeownership is at its lowest level, especially in the Black community, than it's ever been. And we're going back to the 70s. So now what we need, and right now what we're getting is a drop in the bucket. What we need is a comprehensive, direct infusion of these resources to the areas and to the people who can use it the most. And I would say that we should have been targeting some private and some reliable nonprofit entities to handle this money, because it has proven not to be handled properly in the past by government entities. We propose that if you repair these houses and repair the neighborhoods, give them to the first-time homeowners and give them at a reasonable price, you will see the city come alive again, and you will see production be at the highest level. And I'm going to step over into Ricky's lane for a while. If you realize the lead paint, lead laterals were all a fixture in this government in the 50s. It was almost mandatory by the federal government. So why are we not putting pressure on the federal government, not only on these recovery acts, this is a drop in the bucket, but just as those entities were mandatory in the 50s, it should be mandatory removal on the federal government's dime now.
Thank you so much for those comments. You're getting all the love in the chat. What I heard Reverend Brisco talk about is this money at its basic core needs to be spent on housing and employment. And he also made the point that some of these same agencies that have failed us are housing this money in this moment. So one of the questions we like to ask ourselves at the roundtable is, how can we build people power? How can we put the decision-making power directly in the hands of all of us on this call, all of us listening in? We're going to come back to that point. And now I want to invite Ricky into the conversation. Ricky, you sort of talked about Cole, and like we followed Cole's work for the last several years in the budget cycle. Can you talk about the work y'all did last year around ARPA and what that resulted in?
Yeah, you know what? I'll second some of the pieces that Reverend Brisco and that you have been sharing, Devin, is that, you know, when we do business as usual, that's a recipe for disaster. That's a recipe for lit downs. And you know, what Cole has done through, you know, utilizing the nonprofits, a part of the coalition, and the families who've been impacted by lead poisoning, and community organizers. We work with elected officials to get a few victories. So, you know, our first big victory was in the Birthing Moms proposal in the 2019 budget cycle for 2020. This is pre-COVID. And, you know, even at that time, we had already had, I think, one new commissioner in Dr. Kowalik. By the time the program was expected to get up and running, you know, the budget cycle happens in the fall. You know, by, you know, March or April, I think it was, COVID hit. You know, nothing had moved on the Birthing Moms proposal. And the Birthing Moms proposal is a partnership between the city and Milwaukee healthcare partnerships, the consortium of all the big hospital systems in the city, to split the bill of $250K per year to give kits to mothers giving birth in the most lead impacted zip codes. So 5 through 205, 5 through 206, and a few others. And, you know, again, we really never saw that program jump off, even though that was something that was passed in the budget and then, you know, supposed to service as a pilot program. So in addition to, you know, COVID hitting in early 2020, Commissioner Kowalik ended up stepping down after that. You know, just other budgetary constraints at the health department being under capacity. You know, a bunch of people got let go at that time after Dr. Kowalik left. So, you know, we were just like, what's going on? We didn't understand like what was happening, and we were let down because, you know, we supposed to be out here saving families, but, you know, it's all this bureaucracy around why some stuff that they passed wasn't circulating. So, you know, still to this day, the Birthing Moms proposal or program now isn't completely up and running for those same reasons. And then since that time in 2020, you know, I think we got like, or 2019, I think we got like 3 or 4 different health commissioners and just a number of staff that have left or have, you know, gone to other organizations. And one of the biggest constraints is the health department not being able to keep like nurses. And nurses, you know, play a very important role in the entire lead program. And, you know, it's like, why would I choose to come work at the city for like 10,000 less than what I can do in the private sector? You know, so it is attributed to the lack of success in the health department is attributed to, you know, being understaffed, under capacity, you know, just not having the political will to invest in public health on the council side and the mayor side historically. So, you know, that we see that reflection in the Birthing Moms proposal from many years ago, 3 years ago now. So then what we did last year for the American Rescue Plan. So let me take you back to the 2020 budget cycle. Now, this is another testament to just like what's going on. So in the 2020 budget cycle, you know, we realized the state statute says that a child is lead poisoned if they test at 20 or test at, if they test at 20 micrograms per deciliter within their blood, or if they test at 15 twice within 90 days. So it's 20 once and 15 twice. So we asked our health department, like, what's the health department's actionable of, like, what do they define as a lead poisoned child? And they said the same thing. It's 20 micrograms per deciliter. And, the CDC at that time defined lead poisoning as being 5 micrograms per deciliter. 5 is a big difference from 20. There are studies that say that even at low levels of lead exposure and blood lead testing, that lower levels can even cause extreme damage and considerable damage. I saw a study out there that said that if a child tests at 6, they're 60% more likely to commit a violent crime. So, we asked them why. Why is it? And they're just like, we don't have the money. We don't have the nurses, the outreach workers, And then when a child tests at 20, when the child tested at 20, that triggered a public health response where, the records came back from their doctor's office. It went right to the health department. The health department follows up with a public health nurse to be able to educate the family on how to keep yourself safe, best practices in the home, how to avoid lead. And Cole does a lot of work around educating folks around that stuff. So if you're interested, just feel free to reach out if you are interested in learning those practices as well. But the public health nurse is kind of like the relationship builder with the family. Then after that, the health department sends a lead risk assessment team. And these are a few workers who are employed by the health department that have, experience in utilizing an X-ray machine to take thousands of X-rays of people's home to see where the lead is, and then to conduct a report to say, these areas would need to be abated. So they get the public health nurse, they get the lead risk assessment. They also get to be relocated if the lead risk assessment finds lead in the home. And then after that, they lead abate the house. They issue a bid for a contractor. And how that's funded is they get reimbursed, probably about a quarter, if not a little bit more, from HUD if the family meets a specific criteria, and then the rest is public dollars. So, at 20, they had like, so every child is in like 1 I think it's like 5 homes, so 1.5 homes. So that's what would need to be lead risk assessed to see if there's lead in there, if the child is going over by, if the child lives with mom but spends like 60% of the week at grandma's house, right? So, at 20, it was like a few hundred cases per year and a few hundred more homes that are lead abated. So what we did is educate the council members on the actionable level actually being 5 according to CDC standards. And we attempted to say, let's lower the actionable level from 20 down to 5. And went through this whole, debacle, just this back and forth with the health department about how much it would cost. So at first they said it would cost $1.7 million. And this is directly from the health department. A few months later, while the budget was still being discussed, being, in its final stages, they then say it's, $3.5 million, right? Then we get like a new commissioner, then they get like, somebody comes back with, it's actually going to cost $17 million a few weeks after that. We're already at 3 different dollar amounts of how much they said it would cost to lower the actionable level from 20 down to 5. We got the newest health commissioner, Kirsten Johnson, who has been a big asset, is very community oriented and just, aggressive with trying to make sure the lead program is up and running. She brought in Tyler Weber, who used to be a longtime community organizer with Walnut Way, who I had some history with. So, Tyler worked with the budget office, and Tyler's role is the director of environmental health. Tyler worked with the budget office, and the budget office crunched the numbers and realized that the city lowering the actionable level from 20 down to 5 creates an incredible amount of work. Like the numbers jump from a few hundred families per year being serviced to like 1,600 families per year being serviced. And the price tag they gave us for that was a little under 100 million per year. And the majority of the costs in that public health response to a lead poisoning case would be the relocation, so putting the family up in a hotel, and then also the lead abatement bid, so the person's house being repaired.
Ricky, can I jump in right now and just I'm gonna try to keep this going, but thank you so much for sharing those details. And what I heard being said a couple of times is we don't have the money. That's what the health department is saying about lead abatement, which is about our kids. We don't have the money for our kids. That's what I heard. I also heard that part of the challenge in the health department is they don't pay enough. They don't pay a competitive salary for nurses. And so that means it's hard to retain people. I lift those 2 points up to name for other programs that certain politicians want to push down our throats. There's already conversation this weekend. Already conversation with state agencies, federal government. Actually, the Biden administration says he's going to put an additional set of money into policing. Chevy and Evers talking about where we can find money for this. I just want to lift that up, that we have to tease out. Why is it the things that we want, we need, we gots to have, as the chant might say, can't be funded?
I'd like
There's
to add,
always
add
a plot.
to that. I'd like to add something.
Yeah, jump in, Reverend.
I'd like to add, let us be clear, there's no level of lead, zero, that is safe in a human body. And so we need to stop talking about acceptable levels. There's no safe level. Number two, we have UWM's School of Freshwater Sciences. Why aren't they involved in this? We have the Medical College of Wisconsin that should be at the forefront of this. So when I hear that we don't have the funding or the resources, I don't think we have them, but we're not using them. This is a part of the economic failure and excuses of this city that keeps us in poverty, keeps us in bad health, and keeps us on the lower rung of the socioeconomic ladder. And by them putting this bureaucracy on it, we have applied to the Mary Project. That's a part of ARPA. We are training people in lead abatement at Ezekiel, and we are applying to repair some of these houses. But they pick and choose where the houses, who they're going to allow to repair the houses, and the bureaucracy is so long that we have been waiting almost a year and a half to try to repair houses which would be training individuals, which we trained people who are returning to society from jail. We train them on these houses. We train people in lead abatement. And we also train them in home ownership. But yet and still we have to beg to get these fundings to utilize to try to put our people in affordable housing. We are driving our people out of what is normally known as the inner city, even Bronzeville, because of prices and because of housing that they can't afford. And there has got to be a protest or someone that stand up for this and say that we want to be treated like the people in Ukraine. We want you to say that we're under attack, that our lives are in jeopardy, and that we deserve emergency funding in order to fight off this poverty and this prejudice and this discrimination that we're facing in the inner city.
Thank you for that. Yeah, one of the things, Ricky, you talked about going back to like 2019 budget fights. And I remember seeing y'all there and how some of the funding for the Birthing Mothers Project just hasn't been able to get out the door. And one of the questions we got in the chat is, what is the bureaucracy that prevents some of these programs from getting up and off the ground?
It basically was what I mentioned about, and what you said about not being able to pay competitive wages, not being able to staff up and have enough staff capacity to run a program. You know, the staffing changes have really halted us too, because, you know, the Birthing Moms Project is a unique program. It's a preventative measure to put education out there for families. You know, and it also, not having a commissioner for the longest was rough. You know, we had interim commissioner, you know, we didn't have a real like head and leader, somebody to take charge of something. Other challenges too, you know, the city's hiring process being through the DER, you know, the Department of Employee Relations. You know, the turnaround time for somebody to even apply on the city's website is a hassle. And I remember that from a few years ago when I applied at the city for a job, like way back. And it's just like, what? Like, this is complicated. But even after you put the application in, it's still like a long turnaround from when you know, get hired, because it has to be reviewed by this department. You know what I mean? Like, I think it's like people apply to the health department's program, and the DER submits a list of candidates to the health department. So if the health department was like, you know, trying to encourage folks to apply, it's a possibility that they couldn't even make it past the DER to get to the health department staffers that'll invite you for the interview. So it's a lot of stuff like that that just is nonsense and keeping us from being able to service more families and make a real impact with the dollars. You know, another thing too is like the fact that Act 10 happened is something that really plays a big role into that. And, you know, as well as the city knows that Act 10 happened, you know, they need to encourage workers to organize. You know, I love what DPW did a few weeks back with attending that committee hearing and, you know, organizing a sit-in. You know, that's labor standing up for what's right and how the city employees get treated, from the health department to DNS, Department of Neighborhood Services, and then also the waterworks, which is under DPW. You know, they don't have the electricians or plumbers to perform inspections to ramp up lead service line replacement, to do more than 1,000 lead service lines a year. So, you know, it's ridiculous. That's the kind of bureaucracy I was talking about that really prevented the Birthing Moms proposal from being successful still to this day. But you know, we are getting there. And again, I have to give shout outs to the health department staffers that are responsive and connect with us. Nurse Holly Nannis and like I said before, Tyler Weber and Michael Manning, like, you know, those are some good workers and really care about what's going on. So, you know, I hope to see bigger decisions from the mayor and the common council about investing in public health.
Sounds good. Thank you. We're going to take some questions. I know I always come to these with like a lot of my personal questions, but I also try to realize it's not always about me and what I want, but also what the folks who are on the call are interested in. So we're going to take a few questions that folks have submitted in the chat. I'm going to try to wrap us on this section, then we're going to talk about the second tranche of ARPA. So the first question is, and I'm going to start doing these in reverse order. Eric, to your point about why can't ARPA funds be used to pay competitive wages to implement these programs? I think Ricky sort of talked about it. Act 10 is part of the reason. Because other city employees can't bargain, it's sort of over time will suppress wages, like, right? Comparatively, we've seen some departments, fire and police, who are exempt from Act 10, and police in particular, because I've looked at theirs, they can get a 3%, they get a 3% cost of living every year. So that helps keeps their wages competitive. And we also see like hazard pay and other types of incentives to keep them. And we don't see that for other city employees. So that creates some of what Ricky is talking about, that, you know, it's just hard to keep people in that changes capacity. Jane asked a question around, give me 1 second. Jane's question was centered on, are there opportunities to have local health system provide hours from their nurses to help us out? So you talked about like sort of the nurse shortage. Is it possible to rely on local systems or other healthcare entities for support?
Yeah, great question, Jane. And it's going to take that. And it's going to take weaning the public sector off, or doing some huge organizing drives to make sure we have good union representation at city jobs, and, you know, making sure we have dedicated sources of funding to staff up these programs that essentially are violence prevention, right? But so here's an interesting story, and I'll try to be brief. You know, 16th Street on the South Side is kind of like the gold standard for their lead program. And what's interesting is it wasn't until like, you know, late last year that they got enrolled in, or they started working closely with SDC, the Social Development Commission, the CAP agency, which, you know, gets money from the state. It's called the Lead Safe Homes Program, to lead abate a home without a lead poisoning case happening. So, you know, 16th Street just recently started doing that program. But like I said, before they've been doing that, they have a track record of community engagement. They have a doctor's office, a private doctor's office, and they also have a WIC clinic. And all three of those programs talk to each other. They've been able to reduce childhood lead poisoning by 30% in the time that they've been up and operating, just from those, you know, those three programs, the investments that they have to make those programs run, having the medical provider that's able to build that, you know, health-based relationship with a client population. So Cole is trying to bring that to the north side, and working with SDC to, you know, do lead abatement and combine that with weatherization, you know, build contractor support, and also building a talent pool and pipeline. And I think what Reverend Brisco highlighted with Ezekiel and what they've done with the model block is what I'm talking about, a program that does local hire. So where all this money is needed to do lead abatement in certain neighborhoods, we need to make sure that there is, you know, local hire labor standards attached to this, so that the people that are most impacted from these communities are getting these jobs.
Reverend Brisco, we didn't forget about you, but Ricky's sort of popular right now. Ricky's, we're gonna come back to you in just 1 minute. But Ricky, the last question we got was around what are the specific criteria that families need to meet to be reimbursed the percentage of lead abatement cost by HUD? Or are there criteria?
Yeah, there is criteria. So you know, for one, I'm not a complete expert on this, but I can definitely get back to whoever asked this question. But, you know, I know a good criteria, like rule of thumb, is Medicaid. Like if a person isn't on Medicaid, you know, you're gonna have to come out of pocket to some degree. There's a certain requirement for the conditions properties have to be in. I know the Lead Safe Homes program is big on that. Like, you know, they SDC has this weatherization program, and if your roof isn't intact, you're not able to get weatherized, and in many cases, you're not able to be lead abated. There's also standards like you got to have homeowners insurance and you can't be delinquent on property taxes, which for some of these old properties, to Reverend Briscoe's point, there is no money to help those folks with their houses and help, indigenous people that have been in that neighborhood for a long time, people that are indigenous to that neighborhood, the city does not have adequate resources to offer support to the majority of the homeowners in an area. And I think Ezekiel knows that from the model block. On one block, it goes to show you that the majority of the block doesn't apply for a city loan or grant to get a deep infrastructure repair to their home. And I see Erica Sinclair's comment, and that's a great point. There was already a nursing shortage pre-COVID. And, we have to look at other ways. And again, to Reverend Briscoe's point, what the health department has done with ARPA is they've leaned on SDC's capacity to do lead abatement through the lead abatement homes program, and have worked to issue some of the 26 million to SDC to work with contractors and deploy them to do lead abatement. So very good point, Erica.
Yes, perfect. And just like hearing what you said about some of the criteria and like the ways we exclude people goes back to like a comment Alex made. It shouldn't be that damn hard to help people. It shouldn't be hard to help people get their basic needs, but we see the city putting up multiple barriers. The last question I'm going to ask around the first tranche is, we've talked about housing and the amount of money that housing has gotten. We talked about lead. How, like specifically around housing, Reverend Briscoe, have you seen that work begin to get implemented? When we also noted just how much money has been spent, only about $197,000 out of close to 50 or 55, I think, has been spent. So what are you noticing, and where do you see the city, or what are the ways you think the city could strengthen the implementation?
Number one is to increase homeownership. Now, because that is why most of us don't qualify for a lot of the programs, and most of the landlords are absentee or even out of the city, so they don't have any heart in the game. But right now, most of the contractors that they are using are becoming the landlords themselves, like the larger contractors, the Smiths and all of those are just buying houses and use them as rental properties. That is one thing. But the one thing that we're having problems with is convincing the leadership of this city that we need to build our own and repair our own and employ our own and train our own and promote our own contractors in order to build up this city. All of that is being left short in this ARPA program. All of the money is going to the usual suspects. It's going to the ones, they always say that, well, we don't have enough capacity. You don't have enough this, you don't have enough funding. Well, they need to reach down and increase the funding and increase the capacity of the local contractors in order that we can compete on the level and build up our own city. That is what you are seeing in the street now. Violence from people who are being disinherited, people who are being disingenuous all the time, and they are responding out of all of this neglect that we are doing over and over again. By even when you heard from the health care, that's a lot of bureaucracy that could be cut in half with someone with the intent to do so. We need to cut through the chase, eliminate a lot of these barriers, and this money should not be stuck in the air. It also rains in the desert, but it doesn't reach the ground because by the time it comes through the atmosphere, it's siphoned off. The same way that it's done now, that's going through the hands of our politicians, and one hand touches the other hand, and by the time it gets to the hands that need it, it's minuscule.
Yes, thank you so much. One question I'll ask folks I'm trying to engage folks in the chat and the Zoom. Yes or no, have y'all seen the impacts of these ARPA dollars in your community? Have you seen one pothole in your community be repaired? So feel free to chat. Like, are you seeing the impacts or feeling the impacts, tasting, smelling the impacts, a video of them? And while you do that, Ricky, quickly, and we're gonna try to move, is you talked about some of the programs like the Birthing Mom that just wasn't able to get off the ground. One of the things with these ARPA funding, and like we highlighted at the top, LEG got $26 million plus about another $3 million for job training surrounding LEG. One of the requirements is that these funds have to be used by the end of 2026. You talked about how other times, like the health department wasn't able to get programs for much smaller amount off the ground and running. Are you confident in the health department to be able to implement this program?
Definitely. And we knew that advocating for this money. So this is what the proposal was that got passed, Devin. So we got 26 million for the health department. So through our advocacy in the budget cycle, we got the actionable level lowered from 20 to 15. Through ARPA, we got it lowered down to 10, right? So in addition to that, we got money for Employ Milwaukee. We got $3 million for them to train 250 lead abatement workers over the course of 2 years. It's actually training 400 people, but with attrition and knowing that folks might not be interested in lead abatement and might want to do something else, we said the number's 250 over the course of 2 years. And that's working with SDC, working with Revitalize Milwaukee, and getting folks in the most lead impacted zip codes state certified to work on these jobs. And then we got $2 million for the Milwaukee Environmental Collaboration Office to weatherize and retrofit 100 homes at about $14K a pop. They'll utilize a total of $1.4 million to weatherize 100 homes that are undergoing the lead abatement process. With the remainder of the money, and I'm glad Jane put that question in the chat about can we braid those resources to combine weatherization and lead abatement? Definitely. So the ECO office will be working with the health department to look at adopting what's called the Cleveland model. Cleveland is the gold standard for building coalitions around lead and also finding dedicated sources of funding via hospital systems, via philanthropists, and also via state dollars that invest in a fund to do outreach with community workers in neighborhoods that are most impacted by lead, to do weatherization and lead abatement with low interest loans and grants to property owners that may not be applicable for things like the Lead Safe Homes program or the criteria that they don't meet when a child is lead poisoned. So what's interesting about your question, Devin, is that alone government is not going to be able to do this. They're not. It's impossible. There's a need for community. There's a need for community decisiveness and community decision making to be able to work in coalition with the private sector, with funders, philanthropic organizations, healthcare systems, utilities. We need the community to be able to make the decisions and how that process is mapped out and what's going to work best.
Sounds good. Yes, thank you for that. Just very quickly, one question that I do want to get to is ask, like, couldn't the lead program that's training up abatement workers, couldn't we also use that to target and employ formerly incarcerated folks?
Oh yeah, definitely. And that's where we uplift Reverend Brisco and the work at Ezekiel and put that front and center when we talk about these jobs coming to 53206 to protect families. But it takes organizing. It takes collaboration, as I said now, and I think more than anything, those who are listening and moved by this, let's keep in touch. I invite you to sit around a cold table and help us stand on people's neck about protecting these kids and keeping our streets safe and making sure we can make some money off it. So,
yeah, we have 25 minutes left.
The formerly incarcerated are one of the most denied groups when it comes to housing and when it comes to placement and employment. And that is where the lion's share of this money, some of this money needs to go to that forgotten population.
Yeah. Yo, Wisconsin, we're talking to you. Milwaukee, we're talking to you. If you are going to arrest, criminalize, imprison our people, you have to be prepared to support them, right? When they come out. So we have to be invested. We have to be invested in struggling to get more of our people out of cages, whether it be our Black mamas, but we also have to be invested in supporting them when they're home. We're gonna move. I asked at the top of the call for folks to talk about what are the ways, if you had to spend $200 million, how would you spend it? And this is some of the things I heard. I heard housing programs, and we talked deeply about that. Art and jobs. I heard educational opportunities, multiple times. Infrastructure, deep infrastructure work. That's what folks in this call tonight, assembled here tonight, are talking about. With the second round of ARPA funding, which the city has just received, this is their plan. And I'm going to talk very briefly, and we're going to move back into conversation. I'm not going to talk quickly. I'm just going to limit my remarks. I'm going to rephrase it. So one of the things that we're seeing over the next 2 years, they're asking for $80 million each of the next 2 years. So $160 million out of the $197 million to be spent not on expanding programs like people are saying, not on increasing pay for people like people are saying, not on more housing like people are saying. Instead, they're asking for this money, this once in a generation money, to be used to fix a structural deficit. I'll tell you very briefly how this structural deficit was built. It was built on the backs of policing and their pensions. So the city will try to lie and say that all the other things. It is built on the fact that we decided, not us on this call, that they decided, not us, they decided year after year, we're going to spend close to $300 million on police. And with the $300 million a year police budget, we know the pension contributions are exorbitant. So the city's facing this, and they're trying to balance a budget with our money. With our money. Here's another way to look at it. They're going to call it revenue loss. When we see revenue loss, let us not believe them for a second. It's not lost revenue. It's pension costs. How do I know it's pension costs? Because they've been having this conversation for the last few years, telling us what they can and cannot afford because they said we have to save for pensions. So let's look at it. Let's look at this. Revenue loss. So 81% of the second tranche of money, the second pot of our public dollars, I'll say that again, 81% of that money is not going to be used to expand the programs we've talked about for the last hour and 10 minutes. It's not going to be used for more opportunities for our young people. It's not going to be used for jobs and housing. It's going to be used to fill budgetary holes. And guess what, y'all? Guess what? I don't know who I'm talking to right now, but guess what? We know in a budget where the police receive 46% of it, a large portion of this $80 million is going to be covering them. That's the long and the short of it. And this is the kicker, y'all. We can see it here beautifully. Well, this is not the most beautiful spreadsheet, but we can see it beautifully here on this slide. They're trying to leave us with 13%. Think about that. They're trying to leave us with 13%. That's not right. I'm gonna stop sharing because I don't think I did this right. I'm gonna jump back in, show one quick clip, and we'll keep moving. That is why we're asking for participatory budgeting. Tune in here.
Participatory budgeting gives people real power over real money to make the decisions that affect their lives. First, people brainstorm ideas. They come together in neighborhood assemblies and think of what kinds of projects would they like to see in their neighborhood. Volunteers take people's initial ideas and turn them into real projects. And they bring them back to the public for a vote. The project with the most votes get funded. They are then implemented over the next few years, and the following year, the process starts again.
Quite simply, y'all, we need to be deciding how our money is spent. We need to be deciding how our money is spent. And this isn't good. This isn't it. I'm gonna ask, sorry, this has been such a rich conversation. So like I said, I'm gonna just pose this general question. Like I said, 80% of the second round of money is they're just planning to use it for what they label as revenue replacement. And we just talked about that. How does that where do I want to go? Why is that a bad decision in either of your opinions? Maybe Reverend Briscoe.
It's a bad decision because it's not the will of the people. It's not getting to the heart of the matter. It's asking government officials, what would you like? Would you like your salaries to remain the same? Would you like to hire more of your friends? Or would you like to feel secure in your home? It's asking them, so they're deciding that they're going to spend money on what's important to them. What's important to us is our children, our homes, and our communities. We want our children to be safe. We want our communities to be prosperous and look good. And we want that at the sacrifice of the downtown area. Because we generate the funds for the downtown area. So why shouldn't those areas that we have hold sacred to us be more important? But that then again, once you put it in the hands of bureaucracy is always going to take care of itself. And it's always, and I will leave this example and I will move on. The Bucks, I love the Bucks, but that was the worst deal in the history of mankind. We gave away everything and got nothing. And we are suffering for it. And that's what most of this is about now. Lost revenue that they're trying to make up on the backs of the people.
Thank you so much for that. We have about 10 minutes. There are several questions. This has been such a rich conversation. I say we create these agendas and they mean nothing because we want to talk and be in conversation with you all. And so one of the things that, one question we had is like, how, you talking about, okay. And Dorothea, let me know if I'm like not getting your question right. But the question in there that I'm reading is like, what about the added layer of other federal support being an infrastructure bill? So Biden talked about, he ran on, I don't think it was the best sloganeering, Build Back Better. That didn't happen. And I know a lot of folks expected that to happen, and that was going to do some other key infrastructure work around, I think, lead pipe removal in the city. But that didn't pass. And I know, Ricky, you follow that closer than I have. Have there been any movement, or what has the movement on federal infrastructure money been?
So right now, Senator Joe Manchin. So what happened is Biden had he had the American Jobs Plan, which came after the American Rescue Plan, and then morphed into Build Back Better, which was twofold, which was two bills. One was the Bipartisan Infrastructure Law, or the Infrastructure Investment and Jobs Act, which passed and is signed into law, and money is being distributed to DNRs and state DOTs everywhere right now and what's interesting about Build Back Better is, about the Bipartisan Infrastructure Law, is that it has a bunch of different existing programs that are just going to receive, a ton of money so that they can ramp up the work that they do. And then also has a number of new programs, many of which are competitive, in which, states will be applying against other states, cities against cities, nonprofits against nonprofits. So, there's a lot of good resources in there for water and transportation, manufacturing. There's weatherization assistance, which helps to do weatherization. It has a little bit of money set aside to handle home environmental hazards like lead, but by no means is it enough. And, the Build Back Better Act, which was the second part of the Build Back Better plan, which is a reconciliation bill that would just need the majority of this, would need every Democrat in the US Senate to vote in favor of it to pass. So through the House, it would take its normal procedure, and then through the Senate, they would just need to have a party rule, and that would have been law. But you got centrist Democrats like Joe Manchin and Kirsten Sinema that really have bogged that down. So there are talks now. Manchin is interested, especially after the Ukraine stuff, in reviving Build Back Better. Many of the clean energy tax credit investments are very safe. And the money, so what was estimated to replace every lead service line nationwide was approximately $45 billion. And that's just for the lead service lines that we know about. There's no real way for folks to know where a lead service line is unless you dig up the ground. And when water mains and breaks and leaks happen, that's how a lot of lead service lines get replaced, which is very inefficient and wastes a ton of money, versus having a homeowner reach out to the city and have them plan, or having an entire block replace their lead service lines at once. So Manchin is trying to, he's trying to play this game of like, who has the pen, who's going to author the new bill that I'll vote yay or nay on, which is weak. And he's really holding up the progress that we can make and the help that we need. So you'll be happy to know that most of the Democrats in the Wisconsin delegation will be in favor of it. So we'll just leave it at that. And then, the bipartisan infrastructure law that passed, that money is unlike ARPA in that it wasn't a huge lump sum of dollars at once. What that is going to be an investment to the existing programs over a course of 5 years. And then the new competitive grant programs will be announced as they start to roll out.
Thank you for that. Probably have time for like 2 more questions because I want to honor folks' time. And like for folks who have asked questions that maybe haven't got answered, we hope we are going to be trying to respond and answer to them probably in a follow-up communication. One question that I can't wait to answer is Larissa asks, where do the Black politicians stand on participatory budgeting? Great question. They don't stand firmly enough with us. And that's just the reality of it. While Alderwoman Coggs has put forward proposals for participatory budgeting in both in 2019 and last year during the ARPA cycle. And while she has gained the support of several of her other Black Alder people, they haven't been committed enough, and they haven't fought as hard as needed. Again, everyday people, we're saying we deserve to have that power. And we're also naming that we expect our politicians to stand with us in these asks, in these demands, and fight like heck to see them through. And we haven't fully seen that. That's the reality. Can that change? Yes. Do we hope that will change? Yes. That's why we organize. But we're going to continue to fight and have the conversations we need to have, and invite y'all to have join in on these conversations to make sure that all these other people, that all the elected officials know that in this moment, in this city, that we deserve the power to determine how our fundings, how our money is spent. Let's ask one more question, and then we'll move to some next steps and some closings. Yeah, Marquesa, that's why we must build power and organize and fight like heck to win. I was very moved, personal privilege, very moved, during a recent trip I took. And all the person said is, I wake up and I'm ready to fight because we will win. We do this work because we deeply believe, and we have to always believe, that we'll beat the other team. And so that's what we're trying to do, build power and have these conversations to build power to win. One more question, sorry. Let's not get started with chance. The chat's been so active, I sort of lost a couple of questions. But one question that I got from I believe Charles earlier in the evening was around is there any collaboration between reckless driving and violence prevention? Okay, and I think the question, right, how I would respond to it is that simply that right, the police get $300 million every year. Nobody's going to convince me, if they can't stop reckless driving with $300 million every year, that they're going to be able to stop it with an additional $1 million. That math just don't add up. That math just don't add up. Maybe it's just me.
That's deep, Devin. That's deep. Wow, man. How much more money we need, man.
And so our response is again, we don't act like reckless driving doesn't exist. I'm not naive. I drive down Fond du Lac, I drive down these streets and I see it. But instead we want to respond what are the solutions that aren't carceral? Maybe there's some engineering. And yes, that is violence prevention, to do the work to engineer safer streets, whether that's traffic calming measures. And maybe we do have to just say we're going to slow down 5 miles per hour at times, if that's proven to be the method. So we always want to lift that up. One question is, I think going back to, and this comes from Facebook, so we'll get it in and we'll move to a close. Going back to how do we engage directly impacted people or formerly impacted people, incarcerated people, is somebody writes, I've seen glowing commercials about the Joseph Project. Currently, I don't know what that is. Helping to employ formerly incarcerated people. Is that working? Do either of y'all have experience on that? If not, we can try to.
That's Ron Johnson's golden child.
Okay.
That's basically busing people out of Milwaukee to Sheboygan and busing them back. And I don't want to criticize something, but I'm just telling you what it is.
We got a lot of work right here where we need that kind of opportunity. Yeah.
Sounds
Yeah.
good.
And they got apartment buildings in Sheboygan.
Yeah.
See, they could spend money like that, you know, to make stuff happen, you know?
Thank you for that piece as well. So there are a few questions. Unfortunately, we didn't quite get to answer, but we do really appreciate you asking those questions. We'll work very hard on our end to get those questions answered in some form of follow-up communication, because we do want to like name, and this was an info session. We do want to like try to respond and answer as many things as possible. What's next? What can folks do? How can we take action? What can we build together? Those are questions we want to try to answer. So currently, if you've been moved, inspired, you're saying, yeah, we do deserve the power to determine how these funds are used, sign our petition. We're going to drop that in the chat right now. Sign our petition. That's one easy first step into saying, like, actually, I'm ready to voice my opinion and to name that I deserve to decide, not you. That you deciding to take 80% of these public dollars for your own agenda isn't right. So that's the first thing. The second thing, we're going to be hosting a little bit of a rally press conference situation next week, Thursday. Next week, Thursday at 10 a.m. If you want to show up and let it be known that you are not on on their team, that you want to join our fight, be a part of the conversation we're having, email me so we can get you more information, so you can be standing shoulder to shoulder. That's what it's about. How can we stand shoulder to shoulder with each other to build the solidarity, to build the power it takes to win? So that's another thing we have coming up in regards to ARPA. And so both of those things should be dropped in the chat. Sign up, let us know, join us, commit to joining us. Marquesa put in the chat, I believe that we will win. I do too. But in order to win, it takes more and more of us taking more and more consistent action. My friend Ella Baker says that we have to fight every day of the year, every year of our life until we win. Who's ready to commit to fighting? At least many of those days. Maybe you haven't got to the everyday yet, but can you give me next Thursday morning? You ready to join us, to take action? Can you give us that? Can you take another 2 minutes and be with us and sign our petition? Yeah, let me know. Put in the chat, we'll definitely follow up, and we want to build the power it takes to win. We organize in service of our lives. That's what I learned. We're not doing this because it's fun. We're not here at 7:28 on a Tuesday because it's fun, but we do it in service of our lives to gain this information. Marquesa, we're gonna do it. Marquesa puts in the chat, Asada tells us it's our duty to fight for our freedom. It's our duty to win. We must love and support each other. We have nothing to lose but our chains. Join us. Mary Hooks talks about the mandate for Black people in this time is to avenge the suffering of our ancestors, to win for future generations, and to be transformed in service of the work. Join us. Join us. I want to thank you all so very much. Thank you, Ricky, Diaz. Thank you, Reverend Brisco, for joining us. Thank you all the wonderful people who joined us tonight on Facebook and the Zoom, who asked wonderfully brilliant questions, who sat with us for an hour and a half. Thank you. And expect to follow up, and let's commit to go deeper, to struggle more, to be in more conversations, to make these people who want to decide how our money is spent uncomfortable. I thank you all so very much.
Devin, and thank you, and Marquesa.
Yes, yes, yes. Thank you all so very much. Have a wonderful evening. Can't wait to see so many of y'all next week, Thursday. Bye, friends.
All right, thanks, guys.
Good job, Devin. TTYM.
Oh, thank you.